Hello, 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 everybody. Thank you for coming to my channel. I'm Dr. Perkins, a board-certified OB-GYN, and today we are talking about, can endometriosis stop pregnancy? Now, this is a topic that I will tell you I get questioned about a lot. And so we're going to dive into what exactly is endometriosis. Does it cause infertility? How may your ovarian reserve be affected by it? And we'll finish up by talking about when you should be evaluated. All right, so let's talk about endometriosis. Now, endometriosis is a condition that is chronic. It is long-standing. It is painful. It is probably very aggravating. And so if you're experiencing it, I hear you. I feel you. It is a tough condition to diagnose, to manage, and treat. So let's talk about what happens with endometriosis. Now, you may know this. This might be new information. Let's start by just looking at my uterus, my little plush here that is a very unhappy plush because, again, endometriosis is not a fun condition. And so this is a uterus. Here are the fallopian tubes and an ovary. Okay? Whenever we consider endometriosis, we're thinking about the lining that is normally on the inside part of your uterus. This is the part of the uterus that makes your periods, the part that supports a growing pregnancy. This is the heart and the life of your uterus. And so that tissue is very active. Imagine, it changes after your period, it sheds, it bleeds. This is the part that builds an environment that helps to feed and nourish a baby. It does a lot of work and does that work throughout your entire reproductive years, from puberty all the way to menopause. That tissue should really just be on the inside part of your uterus. It should remain there. But in endometriosis, tissue very similar to that is located elsewhere in the body. We're still trying to figure out why this happens. The theory, it goes as such. We think that when you have your period on a monthly basis, on average, we have about 480 of them. What happens is that instead of periods coming and exiting the body as we expect them to, in some people, it may actually go upwards through the fallopian tubes and may fall inside of the abdomen. So think of this as your period just not escaping entirely, and it's actually going internal at times. Now, when this period-like tissue goes into the abdomen, it can be anywhere. It could be on your diaphragm. It could be on your fallopian tubes. It could be on your ovaries. That's what you're seeing here, all these little red spots here, right? These are period-like tissue, endometrium-like tissue elsewhere in the body. Because of this tissue being elsewhere, it is very active and it still responds to hormones. So when your hormones say, hey, uterus, I'd like for you to get thicker and get more active and prepare for a period, these tissue elsewhere in the body is doing the same. So it's going to say, okay, I'm going to get thicker. I'm going to have more blood flow. I'm going to do all of these things. And then when your hormones say, hey, we did not get pregnant this month, it's time for a period. That tissue elsewhere in your body does respond in the same way. And so you're bleeding from your uterus. You're bleeding out through your vagina onto a pad or a tampon or anything that you use for your period support. But you're also having these mini bleeds elsewhere in your abdomen. And so because of this, you can have excruciating pain. You can have a lot of inflammation on the inside. You may have scarring elsewhere in your body. And so it could cause you to have adhesions and essentially a lot more activity inside. And your internal environment can be one that is very disruptive and very inflamed and very painful. Because of this can affect the rest of your fertility. And we'll talk about how that may happen now. In general, inflammation in your pelvis, in your body, in your abdomen may cause your normal systems to not function normally. The quality of the eggs being released by your ovaries, they're affected by inflammation. Your anatomy on the inside may be distorted as well. your fallopian tubes, they may be blocked or even become inflamed because of this underlying endometriosis. Now, when we think of the fallopian tubes, let's take a look again. We have 2 of them. These fallopian tubes don't produce hormones. This is not their purpose. Their purpose is to be a place for egg and sperm to meet together. This is where fertilization happens. This is so important for this process to work well. You make your eggs in the ovaries, they ovulate and are released into your fallopian tube. Sperm enters the uterus, meets the egg in the fallopian tube, fertilization happens. If you have underlying scarring, underlying inflammation, anything that disrupts the integrity of your fallopian tubes, then egg and sperm won't meet. And so this could be a reason why pregnancy isn't occurring. Now, endometriosis can be mild, moderate, or severe. The important thing to know about this is that the pain that you feel is not relative to the level or the degree of your endometriosis. I've seen where severe endometriosis exists and someone feels no pain. And I've also seen where there's just one mild change internally, but this person experiences a ridiculous amount of pain. So it is not a reflection of what's going on the inside. It's more so a reflection of the activity of any implants or any tissue elsewhere in the body. Now, many people with endometriosis can conceive naturally, and they can continue through pregnancy completely normally. They can deliver completely normally and have a normal postpartum course. Some people, though, are affected and can be infertile due to this. Now, there are ways for us to actually check to see what's happening. First, we want to get a diagnosis by surgery, right? Remember, endometriosis is not diagnosed by imaging, not by ultrasound, not by CAT scan, not by MRI. And so we want to take a look inside and establish your stage. Once that part is done, if you're at the point of trying for pregnancy and you're under the age of 35, you may try for up to a year. And if pregnancy isn't occurring, this is time for you to now come into our office, talk to us, let us know, give us all the information about your period tracking, your ovulation tracking, sexual activity, all the things so that we can help to guide you. And once we've established that you've done all the things and we're still not getting pregnant, we begin testing. If you are older or greater than the age of 35, we accept trying for about 6 months instead of 12. The reason is, as we get older, our eggs are dying every day. It's been happening since birth. However, when we think about all the eggs we were ever born with, and by the age of 35, we know that a majority of them are already gone. We want to make use of our time. We want to make sure that if we need to intervene and help, that we do this a little bit earlier. So that's really the only difference between the timing. One of the testing that we can do almost upfront is to check to see whether or not the fallopian tubes are completely open. It is a very, very simple test. What it requires is going to a radiology department and we'll put dye through your uterus. This dye will pass through the uterus into your fallopian tubes, and this will give us an idea of whether or not they're patent, whether or not they're open, whether or not they're functioning well. If the dye passes through just fine, your fallopian tubes are okay. If it doesn't, then that tells us that we have a blockage somewhere. And if we do have a blockage, it could be because of the scarring or the activity or implants that comes with endometriosis. So if you've been trying, please get to an office, an OB-GYN. If you've had endometriomas, which are cysts that can form on your ovaries that contain essentially period-like blood, if this has ever been seen on a previous ultrasound, there is a reason for you to see us in the office earlier in the trying to conceive phase so we can take a look at what's happening. If you've had prior pelvic surgeries, whether it be for a cesarean section because of diagnosing endometriosis or some other surgery, and you've been trying without effectively conceiving, this is another reason to come in. There are many different treatment options, and a lot of different additional testing that can be done to help you through your journey. Your hormones and reproductive system gives us a lot of information. And sometimes you can't necessarily be able to interpret that on your own, but that's why we're here. And in addition to that, that's why I created my ebook, a very free ebook, by the way, Hormones Don't Lie. Because I know that we have questions. I know that we're hormonal people, and I know sometimes we need a little bit of assistance to help us through the journey. If you'd like for me to send you a free copy of my ebook, Hormones Don't Lie, guess what? Super simple. Just click the link below in our descriptive area, and I'll send that right over to you. If this information has been very helpful for you, please share it with someone or comment below. I read them all. I'd love to connect with you and help you through your journey as well. Thank you so much for being here today. Thank you so much for listening in, and I hope to see you next time.